And to talk about the measles outbreak in Adamawa State, I'm joined live on the news by Commissioner for Health in Adamawa State, Felix Tangwami. Good evening. Glad to have you join me.
Good evening.
Let
Thank
me
you.
start by asking you, why do you think we have an outbreak of measles in Adamawa State?
Well, the reason is because of non-compliance to the rules of vaccination. There are some communities, because of beliefs, that they felt they should not be vaccinated, and that exposed them to susceptibility. And so, when there was an attack from this virus, those communities were affected. So we have what is called non-compliant communities. Usually in the outbreaks like this, especially that of measles or in vaccination, you have people who felt they shouldn't be vaccinated. They have this belief that if they do, the population can be reduced, or their female children cannot give birth to children again when they get married. So these are some of the factors that cause the measles outbreak. On the whole, the sure reason for the outbreak is lack of getting the vaccination so as to build immunity against measles.
Now, you talked about vaccine hesitancy being a contributory factor to this outbreak of measles in Adamawa State. What steps are you taking to sensitize the people in taking vaccine to prevent future occurrence?
Yeah, we have been mobilizing, we have had sensitization visits, and the disease surveillance officers in their localities are also doing a lot of advocacy. The governor has involved all commissioners for people to move back to their local government areas to ensure that people are sensitized to see the need to take these vaccines when health workers come around for vaccination. Those areas that were affected, uh, vaccination is going on, reactive vaccination is going on, and we plan to do a mop-up vaccination for every community that we have trace of such outbreak. So therefore, a lot of advocacy is going on, a lot of education is going on, and enlightenment to have the people take these vaccines, and they are responding positively.
We understand that public and private schools for now have been shut down in Adamawa State to prevent, further spread of measles. Beyond this, what other measures
Yes.
are being taken to curb the spread of measles in the state?
Well, I've earlier on informed you that we are having a reactive reactive vaccination in those areas. And like you rightly said, the disease is a highly communicable disease, having 90% secondary attack or rate on uh, susceptible uh, people or persons that were not vaccinated and come in contact with those that are infected. And therefore, that is what informed the closure of the school for another 1 week. And this is done, this part of the measures is taken to ensure that people remain in their communities to get vaccinated, especially those that have not received this vaccine, so that when they move out of the communities where there are outbreak or there were outbreaks, they cannot spread it to other areas. So we do it. That can be said to be a kind of quarantine, community quarantine, so that people don't move from one place to the other, taking advantage of reopening of school or resumption and spread this uh, disease further to communities or localities where they, they are not affected by the outbreak of the disease.
You talked about reactive vaccination. If you could just expatiate, what do you mean by that? reactive vaccination?
Whenever there is an outbreak uh, in a community, there and people are getting infected, you need to react to the situation. You need to get people vaccinated. That is what it meant, that when there is an outbreak of an epidemic, it, 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 it is necessary for the health workers to move to such communities to ensure that people are vaccinated. So there's an outbreak, you react to that outbreak by getting into those communities and ensure that the communities that are affected are indeed vaccinated. And in this case, you know, those that are most affected are those who couldn't take the vaccines. And therefore, when there is such an outbreak, you need to move to the community. You need to act by going to such community or settlements and ensure that people get vaccinated. That is what we meant by reactive vaccination.
Now, what's your message for those who suspect they have measles? What should be their first point of call?
They should call at our local primary health facilities. We have very comprehensive primary health facilities in all the local government areas and all political wards in Adamawa State. And so if they suspect that they have symptoms of measles, they should quickly report to those facilities. And besides that, let me also inform you that, like I mentioned earlier, our disease surveillance and notification officers are also in those localities. It is their duty to really trace the outbreak of such disease. They know the symptoms, and they know also that they have to take samples of those who they suspect to have such symptoms, and they are to report it to the state epidemiologist so that the persons working in the laboratory can also ensure that these samples are taken and tested. So we have these surveillance officers in all the local governments, and anytime they see such symptoms in a person, and they are right now in the fields because of these problems, it was because they were there that we were able to dictate the outbreak, and therefore they are there. They are also helping the settlements and communities concerned to ensure that they are taken to nearby facilities. So online tracing is there. They are line tracing the people because there's what we call line tracing and active case search. When there's an outbreak like this, you go for active case search. It is not just left for looking at the signs and symptoms. No, when in a community, you have to get people to get their samples, you get them tested to know whether they are also infected or not by others that they have come in contact with, since this disease can be easily spread through cough, sneezing, and contact.
I wish we had more time, but thank you so much for shedding more light on this issue. Felix Tangwami, Commissioner for Health in Adamawa State. Thank you so much for your time.
Thank you.